You can hear me now. I wanted to ask you, you were quoted by the Associated Press as saying that the Trump Big Beautiful Bill would close 35 hospitals in Kentucky and knock 200,000 off of their health insurance. This is a two-part question. How do you know that, and can you cite the source from where you're getting that information? And contained in the bill is $50 billion in rural hospital stabilization. Will that help or have any impact?
So we can send you a number of sources. The Kentucky Hospital Association itself, which is a pretty conservative group, have calculated all of those numbers. This is a $1 billion hit to our healthcare economy in Kentucky, and that's just Kentucky. So even if every state were to get $1 billion of that rural hospital fund, that'd be less than 10% of the overall hit our hospitals are taking. The 200,000 connects up with is both from a group we'll send to you, but also connects to the Congressional Budget Office, which scores how much savings there'll be based on how many people lose their coverage. And certainly that can break down in each of those states. But the way they find those 35 hospitals is how much funding do they get from Medicaid as opposed to other sources. Now, if you lose 10% of all of your Medicaid funding and you're 40 to 60%, Medicaid and your patients coming in, then you can't afford to keep certain lines open. And what hospitals are already talking about right now, I talked to one the other day that was saying they might lose 200 employees, is what lines are they going to keep? Take delivery, which the margins are really low on. I mean, we could face a situation where if you live in parts of Kentucky, maybe you have one hospital an hour this way, and otherwise you're driving to Louisville or Lexington. What this bill threatens is in late in your third trimester, you stay in a hotel hours away from your husband or partner because you don't know when you might give birth, and are they going to make it there to see the birth of their child? So none of these are arguments. They are all facts. They are all how the bill was scored. The only way they scored savings were people losing their health care. But the economic impact, people aren't paying as much attention to. In virtually every one of these counties of the 35 rural hospitals, they are the second largest employer behind the public schools. They likely have the largest budget, meaning the most money flowing into the community. So if you lose 20% of all the employees there, because the number one cost on healthcare is personnel, it's the people that are helping you out, then that is that many fewer people going into the coffee shop, going into the restaurant, or going into the bank. And this is a direct attack on rural America, on our economy, and on our healthcare. Most of the tax breaks are going to go to very wealthy people that live in big cities. And this is leaving rural America behind. And I get that rural America voted for this president, but he didn't tell them that he was going to pass a bill that was going to punch him in the face and ultimately make it that much harder to get by.